So good afternoon, everyone. It's great to see you all here. Great to see the Chancellor here as well. My name is Lorne Babiak, those of you that might not know me, and it is my pleasure to welcome you here today and to introduce our two speakers, Dr. Lorne Tyrrell and Dr. Jim Edwards, who are going to be in conversation over the next half hour or so. Just to give you a little background on the Canada Council Killam Prizes, they were inaugurated in 1981, and they were funded by a donation from Dorothy J. Killam in memory of her husband, Isaac Walton Killam. The prizes were created to honor eminent Canadian scholars and scientists actively engaged in research, whether in industry, government agencies, or universities. A native of Nova Scotia, Isaac Walton Killam became one of the leading investment bankers in the first half of the 20th century. He was the head of Royal Securities. He also owned and controlled many companies, including Abitibi Price, Famous Players Theatre. The next one is one I really like, Moyer's Chocolates, Aluminum Company of Canada, Bowater, Hydro Companies, who became Hydro-Quebec, Calgary Power, and BC Pulp and Paper. So you can see he had his finger in a large number of Canadian successful companies. And then in 1955, he died quickly, and he left his entire estate with his wife, Dorothy Johnson Killam. And of course, he was a really astute negotiator with the government as well, because at that time, 50 million went to the government for taxes. Of course, he negotiated with the government that, or at least this is a story that I was told, that it would go to establish the Canada Council. So that was how the Canada Council was established. And of course, Dorothy was left with a mere 50 million. But she was actually a very astute business person herself. So in 10 years, she increased that before her death to 100 million. So those of you who are investors, take some advice from her. And of course, since they had no children, they always had a vision that their estate would go to support education and research in Canada. And so what they then did, or Dorothy did, she used their 100 million to fund a series of programs which fund scholarships, research at 5 Canadian universities. Originally, it was University of British Columbia, because again, that's BC Pulp and Paper, University of Alberta, University of McGill, which she funded the Montreal Neurological Institute, and Dalhousie University, Nova Scotia. And of course, then when University of Calgary came, we split some of the Killam Trust funds to support the University of Calgary. So there's 5 universities supported by the Killam Trust. And as a result of that, we have the privilege of hosting Killam trustees at the university on an annual basis as they help us with managing of the trust. And she also set aside some money, in addition to the universities, to the Canada Council for the Arts to provide funding for 5 different awards in various fields. And these are the Killam Prizes, which are announced each spring. And the University of Alberta was delighted that our own Dr. Lorne Tyrrell was a recipient of the Health Science Killam Prize in 2015. You will hear today that Lorne Tyrrell grew up on his parents' farm near Duffield, west of Edmonton. He earned gold medals for his BSc in chemistry in 1964 and his doctorate of medicine degree in 1968 from the University of Alberta. Then he completed his PhD in pharmacology at Queen's University in 1972, followed by postdoctoral training in virology at the Karolinska Institute in Stockholm. He returned to the UofA in 1970s, Then he served as chair of the Department of Medical Microbiology and Infectious Diseases for 8 years, dean of the Faculty of Medicine and Dentistry for a decade, and currently is the director of the Li Ka-shing Institute of Virology since 2010. He was a key player in securing a $28 million gift from Mr. Li and the Li Ka-shing Foundation to fund this institute. Again, it's one of the largest donations the University of Alberta has received. His lifelong work on hepatitis B and more recently hepatitis C has resulted in many honors, including the Order of Canada, Fellow of the Royal Society of Canada, Prix Gallion, Distinguished University of Alberta Alumni, induction into Canadian Medical Hall of Fame, and now the Killam Prize. And throughout his career, Lorne Tyrrell has been honored as an exemplary teacher, researcher, and physician. Impressive to say the least. The Killam Trusts have asked the 2015 laureates to take part in a conversation about their lives and work rather than deliver a formal lecture. And this is a new concept that the Killam Prizes have introduced, and we're delighted to welcome the Honourable Jim Edwards to join Lorne Tyrrell in today's event. Mr. Edwards is a former broadcaster, business executive, and parliamentarian who is known as a tireless advocate for post-secondary education. After a distinguished career of nearly 30 years in Canadian broadcasting, Jim Edwards was elected as Member of Parliament for Edmonton South in 1984, and he served with Prime Minister Kim Campbell's cabinet in 1993. From 1998 to 2005, he was President and CEO of Economic Development Edmonton, and he chaired the University of Alberta's Board of Governors from 2002 to 2006. So you can see he's had tremendous interest and influence on the university. And most recently, he has served as a member of the Canada Excellence Research Chair Selection Board and as chair of the Natural Sciences and Engineering Research Council Executive Committee. In recognition of his outstanding service to education, business, and community, Mr. Edwards received an honorary Doctorate of Laws degree from the UofA in 2006. The format for today's event is as follows. Lorne Tyrrell and Jim Edwards will engage in a conversation about Dr. Tyrrell's career and work. Dr. Edwards will then moderate a question and answer session with the audience. So you're going to get a chance to participate, and then I will provide some concluding remarks. So, Dr. Edwards, Dr. Tyrrell, the floor is yours.
Thanks very much, Lorne, and welcome everyone. It's wonderful to see a full house, and Lorne, I know that you're seeing friends and colleagues, and this is something of a flashback for you because friends and colleagues have shown up today as well as many others. Let's go back to last year, Lorne, and I'm calling him Lorne because we've known each other for over 30 years. I would call you, what's the nickname for laureate? Laurie? But I don't think I'll do that. Lorne, let's go back to 2015, last year, when you learned that you had indeed won the Killam Prize for Medical Science. What were you doing? How did you find out? And what was your reaction?
Well, it was interesting. I was working in my office, and I'd seen the phone call had come from from a number in Ottawa. I knew the area code, and I thought this was related to something that I was working with I'm on a health advisory for Health Canada, and I was sure that was it, and I didn't have all the things ready for that conversation, so I put it off for a little bit, and then the call came again, and I picked it up, and it was actually telling me that I'd won the Killam Prize. So it was extremely, a total surprise to me at that point. And
you didn't know you'd been nominated?
No, I knew that I'd been nominated before, but I knew that I hadn't made it, so I thought, well, that's over.
That's that.
Yeah.
Well, it's a very natural reaction. You grew up, as Lorne Babiak has mentioned, on a farm near Duffield, Alberta, which is just this side of Lake Wabman,
right,
on Highway 16, more or less. What impact, what effect did life on the farm, as part of a farm family, have in the formation of your life?
Oh, I think the farm was very important, and actually my brother had joined the Canadian Air Force just a few years before. So I worked on the farm. I learned how to drive tractors at an early age, handled a lot of machinery, learned to do a lot of different things. So I think that was a very important, and also you became involved as a team on the farm. I mean, my dad, my brothers, and we all worked as a team to try to make success. Farming wasn't very easy. The farm life was it was a nice life, but it was a difficult life. Financially, it was not easy. We struggled a bit, and I realized that, and my brother came back from the Air Force, and we came back, he was going to farm, so I had made up my mind I was going to go off to university.
But you must have learned how to fix things and how to improvise.
You did that a lot, and I've been asked for examples of that, but the one that I remember the most is building a road with a Caterpillar and having the track come off the Caterpillar up against the chassis on a serious side hill, and I had to find a way to jack up that Caterpillar, get the track loosened up, get it back on, and when I got it took a full 5 hours to do all of that.
And you were all by yourself?
I was by myself, and then when I got on the tractor, I realized if I make a mistake here, that track is going to be off in 1 second again.
Yeah. And we might not be talking to them.
Yeah, no, well, what I really wanted to do was I locked that side so it couldn't come off and didn't turn the other one, went straight down the hill, and then everything was okay.
So a little evidence of forward planning as well.
Well, I guess you had to, by the time you do 5 hours of work getting it back on, you got to plan how it's not going to come off again.
You got to plan. Animals as well. You were working with animals.
Yeah, we did a lot of work. We raised cattle, hogs, so I got to work with animals a lot, and I think that had some effect on what I did later.
And you got acquainted with ducks, and we'll come back to that a little later.
We had no ducks on the farm, but we had chickens, and I knew enough about raising them that, yes, we did get into ducks.
Good. So now you grew up on the farm, you went to school in a local school in Duffield, and then into Stony Plain for high school, I take it. What did you have in mind? I mean, you mentioned about your brother in the Air Force and the possible career in the farm. What other alternatives were you imagining?
I thought I really enjoyed high school. I enjoyed chemistry. I really thought maybe I would become a teacher and a chemistry teacher. I enjoyed teaching math and chemistry.
And indeed you did become a teacher. So who inspired you along the way? Let's start with childhood, but not limited to that. There must have been teachers or researchers or colleagues who really inspired you along the way.
Well, I did get inspired. I was probably the worst English student in high school. Didn't do well, but the teacher inspired me. Both my French teacher and my English teacher. It's funny, they both inspired me that I really enjoyed their courses, even though I wasn't the best student in them. I just enjoyed them. I knew a lot about chemistry and math, and that was fairly easy, but I think that one of my math teachers, Mr. McCall, was a inspiration, and certainly my other teachers were very much inspiration.
You must have been inspired by chemistry, because didn't it happen that your prof at one point said, is there a Tyrrell in the group here? And gave you 100% paper back.
That was when I came to university, and I think on the farm you had to do a fair amount of work and chores, but when I came to university I would have dinner and living in residence, and I would be able to go study in the library. I think at that point I realized I could compete, and so that was a sort of a vote of confidence, I guess, at that point.
Lorne, you began your professional career in obstetrics and pursued that for about a year or so.
Yes.
And then you were attracted to virology. What was it about virology that caused you to switch?
Well, I really decided when I was going through medicine, I wanted to do internal medicine, but I enjoyed a rotation through obstetrics, and I went into obstetrics for a year. But what I wanted to do in obstetrics wasn't really available. I was interested in early diagnosis or intrauterine diagnosis. Today we have the cloning of genes and markers. It would be much easier, but at that time it wasn't, so I went back into internal medicine And I really enjoyed rotations. An inspiration was George Goldsand, who had just established the Division of Infectious Diseases. And I was on the wards with George, and it was inspirational, and I wanted to do infectious diseases. And as I went through that training, I really found fascinating viruses and viral diseases. And from there on, I knew I wanted to do infectious diseases, but really specialize in virology.
And I note that Dr. Goldsand is in the audience today, right up there. Let's talk about viruses, fascinating subject. We think of bacteria, we think there are lots of good bacteria, and there aren't that many nasty bacteria in the whole scheme of bacterial things. But viruses are a different critter. They're physically different, they're a different size, and they behave differently.
Yeah, they do. I mean, the very big difference is that viruses have to be in a cell to replicate. So there's a very close relationship between the cell and the virus, and the pathogenesis of a virus is often related to how it affects the cell in a major way. So some viruses cause a lot of disease and others cause minimal disease. Some viruses act very acutely and others chronic. And that's how there's a big difference between bacteria and viruses.
So there are no really good viruses out there.
I guess there are a few, but not many.
Yeah. Well, we worry about some viruses. We think of SARS, we think of Ebola, HIV, and of course the hepatitis viruses. They seem to lurk. They seem to be dormant somewhere and then suddenly appear and cause all kinds of havoc. How does that happen? And where are they lurking?
Well, that's a very good question, but let me just say that my career in infectious diseases, we have seen almost one new disease every year, and a lot of these are viruses. And when I went to medical school, there was no such thing as AIDS, there was no such thing as hepatitis C, or even defined clearly B at that time. We had two forms of hepatitis, infectious and serum hepatitis. But then along came some new viruses, and AIDS in 1979, 80, and then defined hepatitis viruses, Hep B, Hep C, and started to see how they were separated into very clear different viruses. And these new viruses, it's interesting, a lot of them probably evolved from African sites or Asian sites that often evolve from bats, are seen as the source of many viruses. We were just talking in the lab today that the bats must have a very different immune system that allows these viruses to persist. And then they get from in the bats into a different animal species, such as SARS, into the civet cat, and then into humans. Or in the Mars that we see is another. Ebola is also seen in fruit bats. So bats are often the source of some of these new viruses. And we have a very new one this now is a Zika virus that we were talking about today in the lab.
That's in Brazil, is it?
It's in Brazil, and it's causing microencephaly, or congenital small brains in infants born to mothers that are infected at certain times with the Zika virus.
Not only serious, but causes tragedy in
yes.
the family as well.
As many viruses do.
Yeah. Now, they come into the human chain sometimes through humans consuming animals that I suppose would be in touch with bats, primates, for example, bushmeat, for example, in Africa.
Yeah. I think this is a lot of the theory between the HIV, AIDS, and that's how this is all got started, is that type of contact that led to the AIDS virus getting into humans and then massively spread.
Back in 1986, when you were teaching a graduate course, you found clues that might lead to the discovery of antiviral drugs to inhibit hepatitis B. And when you started, there was no treatment for hepatitis. You came to lead as principal investigator a global collaboration to combat HBV, one of the first major collaborations between a global pharma and a Canadian university. And this drug that was used for chronic HBV infection came to be licensed in over 200 countries. And at that point, I guess liver transplantation had become almost it was almost abandoned because of the
For
reinfection.
hepatitis B, it had, yeah.
For the reinfection problem. Could you maybe walk us through that story? Because I just touched on some of the highlights
Yeah,
of it.
no,
And tell us about the lunch you had with Morris Robbins.
I will do that. Let me just say that, practicing infectious diseases, you do see some viral illnesses. Let me say that hepatitis was really in the purview of gastroenterologists and hepatologists, but I think I may be the first infectious disease specialist in Canada that started to see patients with hepatitis. And even earlier in the 1980s, I had worked with Dr. LePage, Dr. Carol Cass, and we were looking at antivirals because there wasn't many good antivirals. But Dr. LePage had developed, Alan Patterson and Dr. LePage had developed an antiviral that was used in herpes. And the simple herpes virus can get into the brain and cause an extremely serious disease called herpes encephalitis. And we were one of the first people in the world to use adenine arabinoside that was made by Dr. LePage here at the Alberta, and we infused that into about 10 patients with herpes encephalitis and saw some improvement. I just bring that up because I was interested in antivirals, and the first virus I was working on was herpes simplex with this. Then along came acyclovir, which was a much improved drug, and acyclovir started to be used in herpes infections, type 1 and type 2, and we did some of those early clinical studies with it. So I had an interest in viruses, but we went back to the era A, and Dr. Yuta Praxitis was in the lab at that time, and we started treating a few hepatitis B patients because B was a DNA virus, and we thought maybe we could use era A to try to treat them. And I treated a number of patients with era A, and we thought we saw some improvement, but it was early days and not very good. Then I was asked to give a lecture in biochemistry and to include our work in hepatitis B, and or just my interest in it. And so I was lecturing on hepatitis B, and there was a new paper that was just been published in Cell by Jesse Summers and Bill Mason, and it outlined the replication of hepatitis B, which is a very unique virus in the way it replicates. It's the only DNA virus that replicates through an RNA intermediate. It had many similarities to how the AIDS virus replicated and hepatitis B. So when I saw that, I thought it was very interesting. So I thought maybe we could find a way to inhibit this virus, given its similarities to what was going on. By the way, at this time, it was a great place to work because the whole world was turned to AIDS. And most of the people working on antivirals were working on AIDS, and not many people interested in hepatitis B. So we had about 3 years of being the only group working on hepatitis B as our major research focus. And I had a lunch. There was an extremely good chemist here by the name of Morris Robbins. And we had lunch in the faculty club, and I drew out on a napkin, which I still have home, in a photo album of Morris Robbins and I sitting there doing lunch in that corner table by the faculty club, and drew out the replication cycle. And Morris got as excited as I did. Morris just said, this is going to be fun. I think we can inhibit this virus. And Morris I just want to outline how extremely good he was as a nucleoside chemist. Another message here is you've got to find really good people. If you have some ideas, don't be afraid to partner with some really good people who know more about it than you do. And Morris knew more about the nucleoside chemistry and had made these nucleoside analogs, and he gave me some. Now, at the same time, I had phoned Jesse Summers at Fox Chase and said, Jesse, I loved your paper. I'm interested to know, is anybody using this replication of hepatitis B that you describe in the duct system to look for antivirals? And he said, no. I said, are you interested in doing that? And he said, not really. So he said, do you mind if I try to adapt that system? And he said, I'd be happy to see somebody try it. So I sent a postdoc from my lab by the name of Satoru Suzuki, who is here from Japan. He went for 3 weeks to Fox Chase. He learned how to set up the duck hepatitis culture system. And the whole principle here was the duck virus replicates the same as the human virus, and maybe if we found compounds that worked on the duck virus, they'd work on the human. So he went to there and to Fox Chase. He came back.
And Fox Chase is a pharma.
Fox Chase is in Philadelphia.
Yes.
It's a research institute.
Research.
Cancer site.
Okay.
So he came back and we set up the system here and we started culturing the duck virus and using some of Morris's compounds to see if we could inhibit it.
And it worked.
And it worked. Let me just say that we found that there's 4 nucleosides that build DNA. And there's 2 purines and 2 pyrimidines. And we found the pyrimidines were more active than the purines. The purines were more active than the pyrimidines. And DDG, dideoxyguanosine, was the most active, 10,000 times more active as any other dideoxynucleoside. And we didn't know for sure why that was the case, but at a lab meeting, we were all sitting around talking about it, and there was actually a young girl by the name of Waxing Liu who said, it's interesting that all these hepatitis B viruses, the duck, the human, the others, they all begin with the deoxyguanosine. And maybe the dideoxyguanosine, which we saw was very active, was binding to the protein that primes the DNA. Let me just say, it's as if you had people in this room all stood in line and held your arms one by each other. That's building a polymer of DNA. But dideoxy means you take one arm off, and then you can't build that chain, the human chain. And since the first nucleotide binding to the primer protein was deoxyguanosine, when we put in dideoxyguanosine, we completely shut down the synthesis of hepatitis B DNA.
Now, you said earlier that the route that hepatitis B uses RNA as the route to...
It goes through an RNA intermediate back to DNA.
So did your method, your antiviral method, travel through the RNA, or did it bypass it?
It used the fact that the RNA was the template, but then you made a new strand, the first strand of DNA, and that DNA was what we really tried to inhibit with Morris's compounds. By the way, I would say Morris was such a good nucleoside chemist that he provided the dideoxypurines, which were hard to synthesize, to Sanger, and Sanger used this in the sequencing of DNA and won a Nobel Prize for his enzymatic sequencing of DNA, and had used Morris's compounds here from the UofA.
Wonderful. Now, you mentioned the ducks. There's a story attached to that. There were some ducks somewhere on the campus, and you had some on your farm, and I don't think your dad was excited about that because he didn't have much time for ducks.
There's a lot of stories
chickens,
about the
but not
ducks. You know, let me just say, first of all, that in the wintertime, it's hard to get ducks here in Edmonton that are laying eggs. And we had found a source of ducks in Sparfus, Pennsylvania. And we had these duck eggs shipped. And one morning we were sitting at home and the phone rang, and it was the couple that ran that farm. And they said, we had a fire in our barn last night. We're older, we're not going to raise ducks anymore, and you're going to have to find another source. So I phoned Patricia Marion at UCLA, and she had done some work with ducks, and she said, I get them at a little place called Gonzales, California. And so I phoned him and I said, how can we get the duck's eggs here? And he said, well, I just send them through the mail. So I said, okay, send me a few eggs and we'll see what happens. And we got a dozen, they were fine. And then I ordered more, and finally I ordered 5 dozen. And it was getting in the spring and it was a bit warm, and I got a call from the post office that there was a box down here that had my name on it, and it was sticky and it didn't smell very good, and would I come down and clean it up? So I went down to the post office in Edmonton, and these eggs had come on a conveyor belt and they'd fallen a little distance, and everybody was eating lunch in the side room, so I went in and cleaned this up, and I found 11 out of the 60 eggs were still good, and I put them in a bag, and I left and went over to my lab. And got to the lab, and I received a phone call, and it was from Agriculture Canada. And they said, I understand you're importing some duck eggs. And I said, yes. He says, that's totally illegal. You got to return them immediately. So at this point, we had some pretty good results. We knew we needed these duck eggs badly. So we went to Safeways and got some duck eggs. And no, chicken eggs, big ones, returned them to... And we had, I did sin, I guess, but...
And you're still at large.
Yeah, I'm still at large. But we did, and we used those, we hatched those eggs out, then we took them out to the farm, to where my parents raised them, and on the farm, but we used to keep the ducks here in the poultry farm at the university. And I got to say, my wife and my kids helped. We didn't have much money in the beginning when we started this, but we knew we had some exciting results, so we wanted to keep it going. And they helped in the city. My parents raised some ducks at the farm. We'd go to the weekends, pick up the duck egg, come back, incubate them, hatch up some ducklings, and we could carry on the work.
Lorne, let's talk about, continue on this animal theme, because there is a kind of a backlash in some circles, and I'm sure you've encountered it here on campus, against the use of animals in laboratory testing. Can you tell us the story about the Candle Vigil?
Yes, I came in, I was working late one night in the lab, and I came out of the medical sciences building, and there were a number of people that were sort of almost chanting, but they were carrying candles and walking around the building, near the building. And I came out, and I was curious enough to ask them, what is the occasion, what's happening? And one of them told me, well, she said, we're here because we're burning candles for the animals that are used in research. And let me say that I do everything I can to try to, if we don't need to use animals, we can use cells, that's perfect. But there are times you need animal models, and we needed the ducks. And she said, and we even hear somebody's using ducks in this, or baby ducklings. And I was foolish enough to say, you know, you've come to the right person. It's me. I'm using it. Which I think was, now I wouldn't have the nerve to do that, but I was younger and a bit stronger at that time, maybe. Anyways, then I said, but you know what? I said, I have a patient that came from Fort McMurray. He's 15 years old, who was playing hockey. And he got checked and he got injured. He had some pain in his side. And he was investigated, and he was found to have a large tumor in his liver, too large to operate on. And he's up on the pediatric floor, and his mother is sitting there holding his hand, waiting for him to die. And I said, if you want to come up and meet the mother and the son, we'll just talk about it after that and see if we should continue this type of research or not. Because there's no way to grow hepatitis B virus except in these duck liver cells. And if you'd like to come up and meet them, please, I'll take you up there. Nobody took me up, but they never came back.
Never came back.
No.
You had some difficulty in finding a pharmaceutical company that would be interested in let me pronounce it,
Lamivudine.
Lamivudine. How did that work out?
Well, that's an interesting story, because I first tried to build a company, but I didn't know how to. Didn't know really, and I worked a little bit with Vencap at that time. And Vencap would have funded a catering company in the north, or a gravel pit maybe, but when you talk to them about a chemical structure, it wasn't quite as enthusiastic. And
they glazed over a bit, did they?
Glazed over a bit, and finally I decided we had to partner with industry. And I went to 4 industries. I wrote to Merck, contacted Merck, I knew somebody there. I contacted Eli Lilly, I contacted Wellcome, and I contacted Glaxo. And it was interesting, Merck said, there was a guy named Morris Hilleman. And Morris, I knew him well and met him when I was in Stockholm. He worked on vaccines, and he said, what kind of drugs do you have? And I said, they're nucleoside analogs. And he says, those damn things are poison. I wouldn't use them on anybody. So that was the end of my Merck attempt. Then he went on to Lilly, and Lilly didn't believe our patents would. We had patented this by this time. Morris and I had patented these compounds, and Lilly didn't think our patents would hold because J. Hufnagel at the NIH had also patented nucleoside analogs for hepatitis B. But the mistake he'd made was he'd never had looked in the duck model, but he'd compared what happened in HIV where dideoxycytidine was the very good antiviral. And we knew that dideoxyguanosine was far better, and the NIH patent was for DDC. So we patented for DDG and the purine analogs, and we won that patent, but Lilly was concerned we wouldn't. We went to Wellcome, and Wellcome just sort of said, no, we're doing all of this in-house. It's interesting because a short time later at a Gordon conference, we made a presentation on this, and Gertrude Elion, who was a Nobel laureate working for Wellcome at that time, immediately wanted to know how we could collaborate, and I said, well, I contacted your company, and they said you're doing it all in-house. She said, we've done nothing on Hep B. This would be great. Anyways,
you were then welcome at Wellcome.
Yeah, no, I was unwelcome at Wellcome. Well, I would have been welcome, but the one we ended up with was Glaxo, and Glaxo knew of our work with Era A. That's why I brought it up in the beginning. So Glaxo was anxious to get into antivirals. The only thing Glaxo wasn't sure of is there a sufficient market for hepatitis B? Well, let me tell you, hepatitis B has infected 1 out of 3 people in the whole world. And 1 out of 12 people in the world still carry either hepatitis B or hepatitis C. But 1/3 of the world's population has been infected with Hep B. Glaxo said, we're interested, but we need to do a study for 6 weeks to see if there is a market. And they came back.
A market that will pay is what they meant.
They came back in 2 weeks and said, you're right, there is a market. And we ended up collaborating. We flew down to Research Triangle Park, Morris and I, made a presentation there, and they said they said it was very interesting, and said, why don't you wait here for a minute, and we'll get Jim Saunders, who was the president of Glaxo US at that time. He came into the room. Canada had just passed the bill C, 1998, C-22 bill for
the generics.
extending the patents. So the companies were going to spend more in Canada. And Saunders came in and said, we hear you got something interesting. We're going to work with you. We'll do it out of Glaxo Canada. And it was set up very quickly after that. In fact, in a hotel room, as I was flying through Toronto, I met with Jacques Lapointe, who was the president of Glaxo Canada, and we hashed out the whole basis of the deal.
Well, that's wonderful. Now, you've made a point about cost of treatment, and this, I think, ties into your story about Glaxo. Policymakers, that is the people who write the checks for our whole healthcare system, tend to focus on the cost per patient, I think, by and large. And you, I think, advocate focusing on cost per sustained viral response. What does that mean?
Well, we're getting into hepatitis B and hepatitis C.
Yeah, well, we're about to segue into C, that's right.
Okay, yeah, no, and probably, you know, the drug we developed for hepatitis B, I should say that we had the purine analogs. When we worked with Glaxo and the contract, we screened a number of compounds they had in-house. And one of them we asked to screen was lamivudine, because we knew it worked by unique action as well. And lamivudine showed activity as well, so that this became the lead compound. We did express our concern that lamivudine could become resistant by a single mutation in the virus. And in fact, Carl Fisher, that's sitting in the back of the room, made the resistant virus and showed this could happen, and we contacted Glaxo and said we should go back to the purine analogs. Today, the best drugs for hepatitis B are purine analogs. Tenofovir and entecavir are the 2 primary drugs. So our drug was the first on the market, but in the end, the best drug is still purine analogs, which we had identified a way back. So, by the way, I should say that interacting with industry at that time wasn't exactly popular. This was the first large interaction with industry in Canada. And Morris Robbins had then moved to Brigham Young, and there was an open faculty meeting because of the concern with industry working with university. And the president of Brigham Young was asked specifically around our contract, didn't we think this was tainted money coming in from industry to the universities? And he thought for a minute and he says, you know, you're right, it is tainted. There tain't enough of it. So, you know, I think today people are trying to work with industry. And I got to say that the working with Glaxo and industry, there was never a problem, because we knew that there was a huge medical need for an antiviral for hepatitis B,
Yeah.
and Glaxo also, so we were on the same track.
Yeah. Let's move to hepatitis C for a minute. Can you tell us about the mouse with a humanized liver?
I can tell you a lot about that mouse. It was interesting because we knew how important the animal model was to our work in hepatitis B. And Norm Kniedemann, liver surgeon here at the University of Alberta, was working on an animal model for hepatitis C. He had an outstanding graduate student by the name of David Mercer. And David Mercer is a surgical resident who did a PhD here. And he worked really hard to develop that animal model. They were putting, if you take an animal that has got a skid immune system, has got lost its immune system, like the bubble babies, you can put a skin graft from a human onto that mouse and it's not rejected. So they were putting human liver cells into the skid mouse, and they would not be rejected. However, they didn't implant as well as they should in the liver. We were actually putting liver cells into the spleen, about 1 million human liver cells into a mouse. They travel within an hour into the liver. They stop there, but they don't necessarily multiply. So we found a way to put another gene into the mouse that destroys its own liver cells. So when you now transplant it with human liver cells, the human liver cells can expand in that mouse, and we end up with a little mouse with a human liver. That mouse can be infected with hepatitis C, and we did this in 2001 and presented that at the hepatitis C meeting in Paris, and it was considered the breakthrough of the year for hepatitis C because it was the first time we had an animal model that was not a primate, either a human or a chimp. And in 2011, the Institute of Medicine in the United States recommended that stop using chimps for medical research. And they referred to that paper that we did in 2001 as one of the reasons that you didn't have to use chimps to test antivirals for hepatitis C.
Tell me about the progress that's being made now. You've got the Li Ka-shing Institute here for
Yes.
virology and focusing on hepatitis C, I believe.
Well, we
at the moment.
focus on a number of viruses.
Okay.
There's a number of researchers in there, but certainly we were very fortunate to be able to recruit through a Canada Excellence Research Chair, Michael Houghton, who discovered the hepatitis C virus, which is huge in the whole world of virology. And Michael was moved from California to Edmonton and is the Canada Excellence Research Chair. So we were very fortunate, and that gave a big boost, as well as the idea that we had developed the first drug for hepatitis B, which is the major disease in China, where 7 to 10% of the people were carriers of hepatitis B, and about a lot of people develop liver cancer from it, about 1 million a year worldwide, so that there was a big need for an antiviral. And this has changed hepatitis B, and with the development of different systems, what we call the mouse model, the cell culture system, and the replicon system, we've been able to develop new antivirals for hepatitis C. And hepatitis C is a remarkable disease discovered in 1989 by Michael Houghton and a group at Chiron. And to 2015, this disease is now cured in almost every patient that gets treated with our new antivirals.
It's over 90% among carriers?
More than 90% of carrier, I would say 90 to 95% of all those carriers that are now treated are cured. And they can be cured with 6 weeks of therapy or 8 weeks of therapy or 12 weeks, depends. We have a few criteria. I got to say that a lot of the clinical trials were done, a lot of major clinical trials were carried out here at the University of Alberta. Steve Shaffron has led that process. He's one of the leaders in Canada on the antiviral studies and the division.
Lorne, we're coming towards the end of our time here, and I'm sure that the audience wants to start asking its questions. But I have to say that you've been called a triple threat. A physician of compelling empathy, a first-rate medical researcher, and repeatedly voted by UofA medical students as Teacher of the Year. Which of those three is most gratifying to you?
I've been extremely fortunate to have worked in the field to see diseases, the evolution of diseases. And I would say when I was trained in infectious diseases, what I do today, it's all new. AIDS, hepatitis B, hepatitis C. I've limited my practice pretty well to those. But to be able to see those patients in the clinic now, when I see them and tell them they're cured, after I follow some of them for 15 years, it's a wonderful feeling. In the hepatitis B field, we did the first liver transplant in the world. Norm Kniedemann, Vincent Bain, the transplant was done here, and the transplant programs had been almost shut down for hepatitis B because immediately after you transplant the liver got infected, and often with a more aggressive hepatitis. So it was a question of whether this was a wise use of livers, which are very rare. And the first patient in the world to receive lamivudine pre-transplant and post-transplant was here at the UofA. And to see some of those things happen clinically is wonderful. To give a lecture and feel that you've caught the audience of your medical students, that people enjoyed it, and you felt the enthusiasm for it, then that's a fantastic feeling as well. And one of the things I wasn't sure I wanted to do, and I made a list of should I be the dean or should I not when I was being asked to take on the deanship. I had quite a long list of reasons not to, a fairly short list of reasons to, and when I cleaned up the dean's office 10 years later with Leanne, we came across the list. But I still enjoyed the deanship and leading the faculty during those 10 years. We went through some difficult times, just like now, but the last 5 years, the province was thriving and we did much better, and we're able to work on a number of the buildings that we have here. There's no doubt that we have the best infrastructure, as good infrastructure as you find any place in the world as a result of the investment in what's happened here.
Well, having been on some of those presentations with you, I know how effective a salesman you are, and the results speak for themselves. We're in one of the buildings that you persuaded the government to fund, and it is a fact that the medical research infrastructure at the University of Alberta increased triple-fold during the time that Lorne Tyrrell was Dean of Medicine.
Well, I did have a chancellor. You came with every time I wanted to go to a meeting with the government, and Jim Edwards' name with the government carried a lot of weight, and we got into every deputy and minister we needed to. There's another little funny story in that one. I wouldn't say that Joel Wiener was also critically important in that. I think I had the best dean of research in the country. But we did go see Mr. Klein in one of those visits, and he said, there's been the beef BSE issue, and we've had the forest fires the next year, and he said, by the way, he said, how much money would you need to get started? And when I went to those meetings, I advocated both for Calgary and Edmonton buildings, and I said, I think we each need at least $5 million to engage the planning, and we left the room after that. And I came back here, and we were in my office one day, and an envelope came, special delivery, and I opened it up. It was a check for $5 million. And the university was a little surprised. I got a call from Rod Fraser a little bit after that, and he said, there's been a terrible mistake. He said, that check, shouldn't go to the faculty, it should have come to the university.
The president's office.
To the president's office. And I said, Rod, I understand how you feel. I'm going to send over $4 million. I'm keeping $1 million as overhead. And there was silence at the end of the phone. And then I started laughing. I said, how does it feel?
It's a wonderful
so
story.
Not only was, the triple threat you talk about, there was I was a pain to a number of people as well.
Well, and you never left a stone unturned. Ladies and gentlemen, let's have a round of applause for Lorne Tyrrell. So Would you like to have people signify by raising their hand as to the order of speaking? We have a lady here with a roving microphone. Oh, 2 roving microphones. Dr. Babiak has one. There's someone there, right there.
Thanks, Lord, for those insights into your career and your life. I'd just like to ask your thoughts on do you believe or do you think, rather, that all viruses are ultimately carcinogenic, and that the corollary to that is that all cancers have fundamentally a viral origin?
Well, I do believe that we have seen an increasing number of cancers that are, I mean, there's some cancers that are very clearly virally triggered, and hepatitis B being probably the best example. We've seen a rapid disappearance in the country. Taiwan, the country that introduced the hepatitis B vaccine, has seen a disappearance of hepatomas in children. And in that country there was a lot. So there's no doubt that hepatitis B is an oncogenic virus. Papillomavirus is clearly there. Hepatitis C, whether it's through the chronic inflammation, because usually you have cirrhosis, but the chronic inflammation caused by this virus is associated with it. And there are other viruses, some lymphoma viruses. And I would say now that people are considering at least half of the tumors we see have a viral origin or virus in some way. So it's, and there may be more.
Thank you very much, Lorne. I'm wondering if you could just tell us a little bit about the importance of the funding of basic research to what you were able to accomplish through your career, and what is it that Canada needs to do in terms of the funding of basic research going forward?
I sometimes feel a little bit like guilt because I have benefited so much from people who had done basic research before. Without having the paper by Jesse Summers and Bill Mason, I would have never been into hepatitis B antiviral therapy or have found the drug. I would say that the real problem in Canada today, and the real problem often in politics, is pendulums swing too far. We need to be a little more attuned to the translation and application of our discoveries, but we can never ignore the fact that basic sciences or discovery science is the basis of what really transforms our healthcare system. Without basic research, we wouldn't have found how to grow viruses and produce a polio vaccine. In fact, when I asked people who won the Nobel Prize, Sabin or Salk, for the vaccine that eliminated polio, neither did. Enders did because he found a way to grow the virus, and that led to the vaccines. When I was doing research or doing clinical work as an intern, the most common operation I scrubbed on was the vagotomy and pyloroplasty, because everybody believed that ulcers were caused purely by stress, and you had to cut the vagus nerve and open up a better flow in there to cure ulcers. And Barry Marshall discovered a bacteria, Helicobacter pylorus. We do less than 1% of the ulcer surgery we did in the 1970s and 80s. I think you can go through and we look at the AIDS epidemic. And I can remember when every patient I saw with AIDS knew they were going to die between 11 and 24 months. They all died. I went to many funerals of the AIDS patients I saw in the beginning. However, in 1996, the X-ray crystallographers had given enough information that you could manufacture and create the first protease inhibitor and later a number of other drugs. But from 1996, my practice till I stopped seeing AIDS patients when I was the dean, I never lost a patient with AIDS. And today, many AIDS patients have normal life expectancies. People cannot forget that it is discovery research and basic research that transforms our healthcare system in so many ways. And we're on the verge of a breakthrough in cancer like you will not believe. It may be through the immune checkpoints, and you can just see one thing after another. We have a convergence now of biology, chemistry, physics, bioinformatics, that we can attack disease states and find key targets. But this all depends on discovery research to allow us to translate those. And without the discovery research, we are falling behind. Without supporting it adequately, we fall behind.